One of the biggest mistakes we make when treating pain is chasing the symptom instead of fixing the terrain that allows pain to exist in the first place. In this video, I'm going to walk you through the terrain pain protocol, a simple 4-point system that helps restore electrical balance in the body, calm the nervous system, and shut down pain at its source.
We said we could measure, and we need minus 20 millivolts or greater. The neural levels, or the outside of nerves, are the second most electrically conductive tissue in the body. The fascia is the number one electrically most conductive tissue in the body. And then the terrain pain protocol is about choosing 4 points for the treatment. So we said category 1 is a tissue point. This can be the direct tissue on the body, such as the foot. This can be tissue such as the foot on the ear. This can be tissue such as blood. Blood is a tissue. And we said when voltage decreases in blood, blood goes to a lot of places. So it could be total body pain or wherever blood goes. We can choose category 2, neural level point. We said that we do that by using a myotome chart, such as this. Patient says, I have pain here on their arm. Well, you consult the chart. You see that the C6 dermatome or around C6 dermatome, myotome, sclerotome, or viscerotome has become deficient in voltage, causing a magnetic field, creating pain. We said acuchannel point. This is probably the most important category in all treatments, not just the terrain pain protocol, but all treatments, because the acuchannel system is a power supply. It's got those muscle battery packs that are supposed to supply negative 20 millivolts or greater on the wiring system of the fascia. So we must address the acuchannels. All disease has a component of acuchannel deficiency. We said that the earth channels are the entire mesoderm, genitourinary, muscle layers, and endocrine system. That's an awful lot, isn't it? Mesoderm is muscles, so there's muscle tissue in generally all of the major organs. An example of this, we said that the small intestine organ is a muscle, so the muscular tissue of the small intestine organ is fed by the earth channels, while the inner lining of the small intestine organ is the endoderm fed by the small intestine channel. We said fire channels is 1/3 of the entire channel system. And not only that, it incorporates the autonomic nervous system, which we said the triple energizer is sympathetic and the PC is parasympathetic. Small intestine, the inner lining of the endoderm, is related to autoimmune. We did an autoimmune class. If you want to dive into that, go watch it in the Insiders. And the heart channel, number one killer in the United States is heart disease. So these cover so much tissue that these days a patient can come in, start by ruling out earth channels, start by ruling out fire channels before selecting other channels. Then category 4 can be a global pain point. We have these global analgesics. All of these points up top here are good for triggering the body to produce and release beta endorphins, which is 28 to 32 times more powerful, more potent than morphine. How cool is that, right? We went deeper into why LI4 is the thalamus/pain point, because all pain must go through the thalamus. And if there's pain going on longer than 6 weeks, that pain signaling can make changes in the tissue of the thalamus. It's its own type of leak that we categorize under scars, and you may want to treat that if your patient has pain. Triple Energizer 5's awesome point for rheumatic conditions and anti-inflammation. And by the way, all these points are good for anti-inflammation because when you produce beta endorphins, ACTH is produced in equimolar amounts, which is a precursor to cortisol. All righty. Then we said pain has a component of sympathetic overdrive. When you break your thumb, you get a sympathetic pain signaling, so that there should be an acupuncturist in every emergency room, because we can jumpstart the healing process and skip the first 3 to 5 days of healing simply by turning off the sympathetic overdrive. How do you do that? By stimulating any tissue, neural level, or anything for over 20 minutes. Now we have global sympathetic overdrive, and we also have focal sympathetic overdrive. The example with the thumb is maybe just the thumb and the upper arm is in sympathetic overdrive if you break your thumb. But we do have a lot of patients in sympathetic overdrive, and sympathetic overdrive affects the immune system. And how do you reset that? Well, I put in green here, small intestine 16, and some other points, Sanjiao 5, PC6. The immune system creates the inflammation, so you may want to treat the immune system. Right liver ear area or right body 14 liver is important for restraining the immune system and preventing it from wasting a lot of resources, such as histamine molecules, on the area. Then the actual protocol is simple. You choose your 4 points the way I just showed you. You can do this with needles. You find the point. Let's say you're doing the ear. You find the point on the ear. You mark it. You stick your needles. You hook up the machines and you stimulate it. You can do this without needles. You find the point. You hold the T button on the Pointo probe. You stimulate for 15 seconds, and then you put a gold seed or intradermal needle if you know how to do that. Frequencies, when you're using higher voltage device, we use 2 different frequencies, which blanket the body in 1,000 different frequencies. The body is like a high Q circuit, will absorb the frequencies it needs and blocks out the rest. Power levels, the patient will tell you what's right. Just turn it up until they can start to feel it or barely feel it. When you're using a higher voltage device, which I recommend, use 4 needles. If you're using a lower voltage device, use 8 to 12 needles. This diagnostic technique is in all my classes. It works to diagnose all disease because we don't treat disease, we treat the terrain, and when the terrain is better, the disease symptoms go away. All right, there's our wrap up.
Thanks so much for watching. I hope this gave you a clearer understanding of how pain really works and why treating the terrain changes everything. If this was helpful, make sure you subscribe to the channel and turn on notifications so you don't miss future trainings like this. And before you go, be sure to grab our free resource, The Best 2 Acupuncture Points for Pain. It's a simple, practical guide you can start using right away, whether you're a practitioner or just learning. The link is below. Thanks again for being here, and I'll see you in the next video.